If you've ever thought about trying electroconvulsive therapy, ECT, there's something that you should know about the procedure and how it can go badly awry. I recently experienced something uh, that almost ended my life. I had been on an antidepressant for the better part of 20 years that was very effective for me, um, and it had stopped working. So um, my psychiatrist um, started cycling me through a number of mood stabilizers. We had tried, I think, four um, that either weren't effective for me or had side effects that were really difficult for me to deal with. So since my depression had recently morphed into bipolar 2 diagnosis, she decided to switch me over to lithium. I've been on it successfully uh, for a little while. It seemed like the answer. I didn't have any side effects with it, and my mood was continuing to elevate. So I thought that this was going to be the drug that was going to help me regain some equilibrium in my life. There were a few other things that we were talking about, transcranial magnetic stimulation, vagal nerve implant, or ECT, and my doctor said, let's try ECT. It's safe and it works. So I did my research, and this was no longer the ECT that Randall McMurphy received on One Flew Over the Cuckoo's Nest. Safe, it's effective, and I thought, okay, I'll give this a try. So she scheduled me for 24 sessions. I had received 7 or 8 sessions with it. It was easy, it was quick. I was in and out fast in the early morning, and with the seven or 8 shots at it, it was too soon for me to know whether or not this was something that was working for me, but I was on board to continue. And then something bad happened. The rest of this story is not something I have a memory of. It's what I was told by friends of mine and neighbors of mine. Um, I called one of my neighbors one night and told her I needed to go to the hospital, that um, I was having some sort of manic episode. So she came over, and um, I didn't recognize her. I didn't know her name. I was renting a room in my house, and the tenant had been living at my house for about 5 months. And I proceeded to tell my neighbor that um, there were strangers in my house and people that I didn't know. Um, Besides not knowing my neighbor's name, I also would only communicate in song. Um, so she took me um, to the hospital. I'm a retired vet. Um, for some reason, I had her take me to the university hospital, not to the VA. Um, and I stayed the night there. The next morning, I um, was able to get discharged. Um, I'm not sure quite how that happened. Um, I, I think if they had done a tox screen on me, that they would have seen what had happened. That I had lithium poisoning, but uh, apparently they didn't um, test for lithium. Uh, Perhaps didn't ask me, you know, what medications I was on. Um, so I took a cab home, took an Uber home, and my friends uh, called the cops on me in an attempt to get me to go back to the hospital. And the police refused to make me go. Um, Apparently, I presented normal enough that they couldn't justify uh, sending me off to the hospital. And so that night, I uh, was passing out all over the place. Um, I th- I know that this is the one thing that I do remember. I remember sitting on the couch and just face planting right on the floor in front of me. It's the only memory I do have of this whole 24-hour, 48-hour period. Um, I was in the kitchen making a smoothie um, at around 11 o'clock at night, and uh, I passed out and uh, fell on the left side of my body, um, breaking my shoulder. Um, my tenant was asleep or about to fall asleep, and heard the thud, but since I didn't vocalize, um, he just thought I had dropped something heavy, and continued to sleep or fall asleep, and found me that way on the floor in the morning. Called the ambulance and got me to VA. So what happened is that the um, ECT allowed for the blood-brain barrier to become more permeable, and possibly dehydration um, caused the lithium to get through into my brain in large quantities, causing what's called encephalitic delirium. So on day 5 of being in the hospital, um, I became sentient. To me, it felt like I was waking up for the first time. I was on the telephone with the same neighbor who had got me to the hospital the first time. And I thought that I'd been in the hospital for 11 days. I'd only been in for 5. But this began a period of the most frightening period of my life. My memory was wiped all the way back to the spring. The whole summer was gone for me. I had no memories of the summer. From what I know now about this type of poisoning, I'm lucky that it wasn't worse. I had a hard time speaking. I had to kind of learn how to string sentences together at first. But that came along quickly. The memory, my doctor says that I may never regain it. It just is what it is. I wound up being in the hospital for about 2 weeks. And my shoulder, my humerus was broke in 3 places. I'm going back to the hospital in a few days to have surgery on it, and they're going to use a long nail, and they're going to put it into my arm via the top of my shoulder. They're reassuring me heavily that, it's the kind of thing that they do all the time. But I have to say that I'm very nervous about it. Meantime, I'm still on lithium. I'm very wary about it, and I refuse to go on the full dose. So I'm just taking half right now. There are a couple of other drugs that we could try, but because of what I've been through while my brain is still healing, my doctor doesn't want to start trying new drugs and she kind of wants me to just stabilize. Um, so that's what happened to me. If you're planning on doing ECT and you have bipolar disorder, are on lithium, be aware that although rare, this is something that can happen to you. Make sure you do a lot of research about it, and make sure you're keeping your fluids up during the course of your treatment. Or discontinue lithium during the course of your ECT treatments. The delirium, besides amnesia and the strange manic expression that can occur, having this happen feels very nightmarish, and excuse me, I describe it like living in a waking nightmare. So do your research, know what you're getting into, and perhaps choose one of the other options open to you if you're on lithium. Good luck out there.